Wow, query from Ludhiana, Punjab, my city. How to manage timings, how to take satisfying holiday on Sundays or on other day. Okay. Before I go to point two, let me answer point one. How to manage timings. I always believe that once you are settled into practice, you have the right to choose your time, your schedule, your way of working, everything. I find people with 20 years of practice still afraid to take a Sunday holiday. People with 15 years of practice still not willing to change time. If you can't do that after 15 to 20 years of practice, then it's absolutely of no use your goodwill. I changed my clinic timings last July. I had a timing of 9 to 1 and 4 to 8, almost since the start. No summer or winter, nothing of confusion, simply speaking, 9 to 1, 4 to 8. Last year in July, I changed it to 9 to 2 and 4 to 7. Not even a single patient reacted. They all adjusted. The only thing we did correct was started conveying them at least 3 months before. That is the way to go about it. How to take satisfying holidays on Sundays? Simply, Sunday closed. Not write emergencies only on Sundays. Every pain is an emergency on a Sunday. So don't read that. Having said that, be empathetic. Even though my clinic is in my residence, I still don't entertain patients on Sundays. Unless it is an old patient, unless he's in genuine pain. And unless even though he is a next door neighbor or two house different from my place, I don't entertain them. They know it. They know it. It is simply about conveying to your patients. It's not being arrogant. It's about asking for your own rights. And I believe anybody after 15 years of practice can have those bragging rights. Simple. Just convey and communicate clearly and started prior before you implement the same, so that it does not come as a surprise to any patient, so that an inconvenience is not caused. वो पुराने database को message करना, वो करना, that you can still do. I believe you can say, start informing 3 months in advance. It is a good enough time. If your system is already appointment based, कि नया पेशेंट भी आना है, पुराना भी आना है, रेफरल भी आना है, तो कॉल करके आना है, then absolutely no problem. जब कोई आ रहा है, टाइम ले रहा है, तो उस वक्त उसको कन्वे भी किया जा सकता है ना. These are our altered timings. People look out for these things. मैं पेशेंट को डेटाबेस सारा खोल के सबको पहले SMS भेजूं, WhatsApp भेजूं. No need. No need. You can do that to your amazing and breadwinning patients, but not to your whole entire database of 15 years. Nobody cares. Nobody really cares. They care for you when they are in need. If they're taking a prior appointment, set it up. Why do you need to do that? How to manage lab and material expenses versus profit. Now, this query is from my town, so I will reply it in my town context. People change lab in my town for 25 rupees also. 25 rupees, 50 rupees lab difference per PFM crown, per metal crown, per zirconia crown, change the lab. That is how the mentality goes. If your work is repeated, your lab does not repeat, or even if it repeats, you have to do the chairside time again, you have to take re-impression. I'm talking of the normal work, where you take the normal impression, not the CAD cam or the scanner or anything. Simple ground reality. If you are doing those things again, you're spending chairside time burning materials, where does that 50 rupees or 25 rupees go, which you have saved from a substandard lab? Lab contribution to your overall revenue is hardly changing. The lab contribution is hardly 0.01%. Maybe with a decent lab, you're being charged 20% of the overheads of your total expenses. With that lab, you will maybe have 19.9 or 19.8, 0.1, 0.2. I'm sorry, I said 0.01. I said 0.1 and 0.2. So 0.1, 0.2 difference के लिए आधा भी हो जाए, एक भी हो जाए, is it that important? No. So have a good lab which gives you good work, has you can say there may be fault at some ends. Your end impression may be wrong, their end casting may be short or shrinkage may have happened during the casting. Make sure that they are comfortable with repeating. And of course, wherever you are at fault, compensate the damages in some way. That is the philosophy. I believe that we should have a win-win situation. Not that you always repeat, even I'm wrong, you repeat, even you are wrong, you repeat. That is a lose-win situation. Then the lab is not going to stay with you. Whether you decide to stay with them or not, they are not going to stay with you. So material expenses versus profit. Make a list of the things that you need. Don't rely on social media induced purchases. If those purchases are alluring for you, then you are probably setting up the wrong principles in your practice. Open up your drawers, open up your refrigerators. You will see so many things bought in the hope, wish and pray model. कि एक भी पेशेंट आ गया इसका तो मेरे पैसे पूरे हो जाएंगे, और लास्ट में एक आया भी था पूछने, मेरे पास था नहीं तो मैंने भेज दिया. You buy that. In the next 1 year, it is still lying in your refrigerator. Cost of expiry, cost of obsolescence. These are the things, these are the costings that matter to you. They are the leaking buckets. Purchase should always be based on number one, analysis of your record keeping. How many root canals you do in a month, how many crowns you do in a month, how many dentures you do in a month. Have a breakup of where the revenue is actually coming from in your clinic. That should decide the purchase. And not, ये भी अच्छा, ये भी अच्छा, ये भी अच्छा, दोनों ले लो, सब ऑफर में मिल रहा है. Offers in exponents or anything, they just induce impulsive buying. Much like a festival sale in a mall. सस्ता मिल रहा है तो सारा मॉल उठा के घर ले जाओ. That is not the way to do it. That is not the way to do it. So how to manage finance? Learn about proper numbers. Learn to have a proper buying record. Learn to implement those things.